Hello, this is the presentation for Team 1. Our policy analysis focuses on House Bill 2432, a Good Samaritan law that Representative John Rainey presented in the 86th legislature. Before we look over House Bill 2432, I thought I wanted to share some history on opioids in the United States. The opiate crisis has plagued the United States, can be traced back to the 1800s as morphine and opium were used to ease pain for soldiers who sustained battle wounds during the Civil War. In the most recent increase of opiate abuse in the United States, there has been a result of increased number of prescriptions over the last 20 years, and common prescriptions include codeine, fentanyl, hydrocodone, and others listed here in this bullet point. House Bill 2432 again was presented by Representative John Rainey on February 25th. 3 weeks later, the House bill was referred to the House Public Health Committee for review. And unfortunately, this is not the first time a bill similar to House Bill 2432 has been dismissed. And the purpose of this bill is to reduce overdose fatalities in Texas by providing protection from prosecution to users or bystanders who call in. This policy falls in the scope of the harm reduction frameworks, and its goal is to reduce and minimize the dangers of drug use. As I mentioned earlier, House Bill 2432 can be described as a Good Samaritan law. And a Good Samaritan law offers protections to individuals who render aid during an emergency situation. This can look different for every state as they've created their own version of Good Samaritan laws that applies to their area. Of course, there needs to be consent from the person who is in the emergency situation, and if consent cannot be given, each case will be reviewed. And so Good Samaritan laws would provide immunity to those who call 911 for overdoses. They increase the likelihood of users calling 911 without the fear of being arrested or prosecuted for their use, distribution, or possession of drugs. Good Samaritan laws have also helped decrease the overrepresentation of people in color in the justice system for nonviolent crimes, as research shows that Black and Latinos have disproportionate legal consequences. And since 2007, 40 states have chosen to pass a Good Samaritan law in their own state. And here is a picture and a statistic that in Texas, the rate of opioid abuse has increased to 160% between the years of 2000 and 2010.
So as far as policy modification goes for HB 2432, as stated previously, Texas does not have any Good Samaritan laws on their books. So HB 2432 would be a new policy in Texas for Good Samaritan laws and approaching drug addiction and treatment as harm reduction versus criminalization of drug users. And so what this policy seeks to change is basically that drug overdose is the leading injury related cause of death in America, and that's continuing to increase as the opioid epidemic continues to increase as well. Addiction is a chronic disease, and there's no cure, only manageability. And so when drug users get arrested for drug charges, if they have an addiction, they're seen as criminals instead of being seen as somebody who has a mental health issue, illness, or disorder. And so individuals who suffer from drug addiction do not suffer alone. It affects their whole family and their whole social life. And so HB 2432 will also help family members and giving them the ability to call for help without fear that the drug user or themselves will be criminally penalized. And the premise of HB 2432 will also help meet the needs of drug users who are often dehumanized and marginalized They're a vulnerable population in the United States because they are criminalized, and if they have a drug substance use disorder or suffer from drug abuse, they do not get the help that they need. Instead, they are getting sent to, they're incarcerated, and there aren't high levels of rehabilitation or treatment available in those facilities. So Marissa's going to speak about a little bit more about the policy modification of HB 2432.
So the drug users and others who are witnessing the drug overdose will be more likely to call 911 and increase the chances of a person that will survive the overdose. Many times people are they're worried about getting in trouble themselves, and so that kind of deters that, or their family members, so that deters that. But with this bill, that can rectify that. It connects resources to individuals who are in need of help with their addiction. It provides a safe way for the addicted person to find their strengths and use their voice when calling for help. Individuals find the ability to see through their addiction and find their desire to change. The individual will be able to receive the help they need and survive the overdose, but also receive rehabilitative help they desire. It prepares medical professionals and first responders with the appropriate responses. And that's for law enforcement, it kind of changes their outlook on that also. Directing those in need to resources ensures fewer arrests and lowers the jail costs for taxpayers. It's a Texas Appleseed. Taxpayers pay the average of $60 per day for those detained for any reason.
So this is just a little statistic. In 2018, 115 individuals in the U.S. died per day from opioid overdose. So next, we're going to look at some of the tactics and actions. So the strategy that we use to ensure House Bill 2432 is enacted into legislation and is not overturned, well, it'll need to be a multidimensional and a comprehensive approach. So this strategy will entail three main components as outlined on the slide: research, outreach, and education. The research component is a crucial first step to ensure that we are all well educated on policy, substance use addiction, substance use recovery, and overdoses, and looking at the national rates of overdose and looking at overdose rates in the state of Texas. This will enable us to support our claim that House Bill 2432 will benefit Texas residents and expel any myths about Good Samaritan laws. The next phase of our strategy will be to engage in outreach efforts to better understand how House Bill 2432 could impact those who are still in active addiction and their families. And then as we entered into the education phase, we will create and distribute a media campaign that will educate the general public on the benefits of passing House Bill 2432 and encourage the community to reach out to the legislators to advocate for this bill. It will also seek to educate and persuade legislators to vote yes on House Bill 2432. So this next slide goes into a little bit more detail about the specific tactics that we plan to use. So looking at the very left, the research component, the research will begin with a detailed review of all of the Good Samaritan laws that have been implemented in other states throughout the U.S. and potentially in other countries as well. From the data, we will be able to understand the framing of the laws, the process in which they were passed, and how these laws have affected the entire community. Next, we'll focus our research on the local population to create a clear picture of what overdose rates in Texas look like and how families are impacted by this. So looking at the middle column, with a greater understanding of the issues backed by data, we can begin framing our outreach tactic. So Team our team will need to focus on advocacy or support groups who could potentially support House Bill 2432. So this will include community outreach with the goal of educating users on what the current laws look like. Our next tactic will be to engage with community partners. So we definitely never want to duplicate services. So by partnering with other agencies that are already doing this sort of work on substance use, we can increase the prevalence and efficacy of our advocacy and education efforts. So on this slide, we have just a list of some of our community partners. Researching organizations and the work that they do is valuable when seeking public support, because organizations are trusted entities that members of the community may feel more comfortable engaging with rather than just kind of random individuals. And then the third component of our strategy is focusing on sharing the information that we have gathered with legislators and the general public. So to seek support from elected officials, we will need to write, call, and visit with these elected officials. To make the best use of our efforts, it would be ideal to ask for support from those who are already supporting drug prevention programs. When writing letters asking for support, we'll need to focus on like why the bill matters, how it will support the public and those struggling with addiction and their families, the goals of House Bill 2432, and some statistics specifically in Texas and the area each state representative represents. So for those who do not already support substance use disorder programming, we'll create a media campaign which will seek to educate in a compassionate and a personable and a research-based fashion. So this media campaign will be our final tactic, and the goal of this will be to educate and persuade the community and legislators alike to vote yes for House Bill 2432.
All right, so as we look at as we look at the evaluation of the program or presentation, we can see that we've got a social media page created, which is a really great tool because you guys know a lot of people use the internet to get information. So by us creating a social media page, we're able to spread our message out to all over the United States if needed. Also, by doing outreach to the state representatives and their committee members, we're able to actually to really connect with the people who are in charge of funding, with the representatives who can really impact and really influence on how laws can be made. Another important thing that our team has is really using is the evidence-based research. Evidence-based research is based on actual data collected. So, you know, unlike someone just sharing their feelings or being biased, we actually have facts on why we need to implement this change. And as mentioned earlier, definitely working with other states who have this law. You know, we're gonna use the data from those other states to help provide more support on why we need to implement this this program. And as we work with the other states, we're also going to be able to collaborate with some of the agencies that they're working with as well. So that way we can brainstorm on more ideas on how we can, you know, again, really allow communities to understand the importance of why we need to make this a law. Some of the things that we feel that could maybe improve on how we can make better outreaches by doing something called meet, call, and email. So if we're able to meet, call, and email representatives, whether they're committee members or other representatives, those representatives can actually hear our words and hear exactly why we want to do this. And definitely meeting face to face is very important. Another action we really need to take in consideration is using the faith-based community. There's a lot of churches out there that provide a lot of help to people in need, and definitely substance abuse is something a lot of the again, it's an epidemic around it's an epidemic around the state. So definitely the use of church, the use of faith-based communities is going to be especially helpful. Currently, our project is in the works, so we're working on concepts on how we can get this passed out. But the presentation, our presentation won't occur until 2021. So that's going to be the next legislative session in the state of Texas. So as we think about, as we still look at evaluation, we think about the potential for this policy to be sustained, right? Well, opiate use is an important medical need that our state really needs to address. And right now, with deaths occurring from opiate use overdose, we feel that there's a high potential for buy-in from a lot of state representatives. And if for some reason, some representatives might be hesitant to maybe advocate for a law like this, some of that hesitation might be just from stigma of drug use. The stigma of drug use, it's a very strong stigma. A lot of people, it's a balance between moral need and medical need, and definitely our team is really taking the initiative to really advocate that this bill needs to be based on medical need. And also, what we also want to help the representatives and even the community members is to be empathetic to what's going on with the opiate overdose dilemma that our state faces. So again, as we look at recommendations for the future, we want to make sure that we're using evidence-based data. And then again, we want people to know that this is a medical and health crisis, because if we look at it as a moral crisis or a societal crisis, that's a biased view. So we want people to know that we are providing them data that shows facts on why we need to do this, on how this bill can really help them out. So our recommendation is that we are going to be recommending that not only the state of Texas pass the Good Samaritan law, but that Good Samaritan laws are passed throughout our whole country. Just because we really feel that this opiate crisis is something that hits home to a lot of people. And while we think about the victims who have passed away from this epidemic, we also got to think about the family members who are also affected by the loss of their loved ones. So we want to make sure that not only is it passed in the state of Texas, but it's passed throughout our country. So that's our recommendation.
We would like to thank you for your time and allowing us to present our policy analysis for 5322.